If you're not listening to the Smoke World podcast, you're wasting your time, you mortal.
What's up, folks? Welcome to another episode of Smoke World. I'm your host, Stone. So go grab that stick, go grab a glass, whatever you're drinking. Let's sit back and have a conversation. You can follow me on Instagram at Smoke World Podcast. And I tell you this every time, folks, send those emails into Stone at smokeworldpodcast.com. Again, check out the website. Those are the partners, our sponsors, smokeworldpodcast.com. Today, on this episode, if you're like me, you wake up a lot of times, you don't feel like you got enough sleep, you're walking around, you don't have the energy. Today's guest will be somebody you want to talk to. I'm Dylan and talking to Ree from Hydroboost. Ree, what's up? How you doing today?
I'm doing good.
Great, Ree. All right, Ree, so now we gotta, if folks who listen to the show know how I lay the show out. Ray, we always start off with a little demographics. We like to know who we talking to, get familiar with our guests. So, Ray, where are you from, Ray?
Well, I am originally from Philly. I was born in West Philadelphia, but I grew up and did some parts in North Philadelphia as well. And then I recently moved to Middletown, Delaware, and that's where I currently reside.
Middletown, Delaware. All right. So now we got to ask, because you're on Smoke World. And Smoke World, we love our cigars. So are you a cigar smoker? Have you tried cigars?
I've tried. I definitely tried. And I don't always have the greatest experience from it. A lot of times I get nauseated from it. So I've had to back down from it a little bit.
All right, that's all right. Everything for everybody, but we're smoking for you. That's what we do here. We'll take care of you.
I know that's right.
So if you ain't smoking them, we'll take those and we'll handle that business for you. All right, Ray. So now look, Ray. Now we got you on the show because you and your husband, Chris, are the owners of Hydroboost. So folks are probably looking right now with their eyes glazed over saying, what is Hydroboost? So kind of give us a breakdown of exactly what is Hydroboost, because in the onset I mentioned I'm feeling sleepy. I think I'm feeling sleepy as I'm doing the show right now, but we're not going to talk about that. Low energy, all this kind of stuff. But you actually have something, you have a business that will actually boost some of those things that we discussed earlier. There's some secret remedies here. So tell us about that.
Absolutely. Okay, we are Hydroboost IV Therapy. And what we are a vitamin infusion lounge. And instead of taking meds, offering meds that are PO, like by mouth, we offer meds where we'll give you an IV, we'll sit you in a chair, we'll hook you up to an IV, and we'll infuse it into the bloodstream. With this, it'll help to boost your energy. It'll help to take away your stress levels. It'll even help to improve your sex life.
Okay. Now I know you perked up. Now some folks listening now.
For you. It helps with skin. It helps with liver. It helps with immunity. There's so many benefits from taking these vitamins via IV as opposed to by mouth. Because just remember, when we take meds by mouth, you're probably getting about maybe, I'll say, 10 to 30% of the vitamin once it's digested in your GI tract. But when you get it this way, you're getting 100% of your vitamins. So you're going to immediately feel the after effects, which is going to increase your energy and have you running around and up and ready to go. Our bag, we have so many different cocktails that you can choose from. We have one that we call the Boost one, and this one is to get you up and get your day started, which is composed and packed of a lot of vitamin B's. And everybody out there, I'm sure everybody is aware of their B vitamins, how it increases energy and gives you the boost that you need to get your day started. So we offer all of that. We offer so much, it's overwhelming, but we even can customize it to what you would like. If you come in and say, hey, I don't like the vitamin B. I want to try something else. I want more of C. I want more of zinc. I want more of chromium. Chromium is something that helps to regulate your blood sugars for anybody out there that's a diabetic. It also helps to metabolize carbs and fats, which is good for diabetics as well because that's one of the issues. When you're diabetic, you have the issue with metabolizing your carbs and fats. Um, we also have one called glutathione. Glutathione is something that's really good. It detoxifies your liver. So, sorry, if you are a drinker, and we know that drinking can be heavy on the liver, then that's one of the things that you want to come in and ask us about. But glutathione is also good with cellular repair, which helps to rejuvenate our skin as well. So there are so many benefits to taking vitamins via IV. It can improve circulation. It can support muscle building and strengthening of the muscle. It can decrease joint pain, aches, inflammation. It improves cellular energy and production because we have to remember as we age, our cellular production starts to decrease. We're not making cells the way that we used to. What they're doing is they're dying. So what happens is that we're wondering why we're starting to get hypertension, diabetes, and all these issues that we start to develop, and that's because we're losing our cellular functioning. But we have vitamins that will also help to improve and start to rejuvenate your cells again as well. Um, so if you're interested, come down, come see us. We're located at 3343 Summit Bridge Road, Middletown, Delaware, 19709.
Okay, wow, you said a whole lot right there. I'm listening like, whoa, I got lost a little bit, and I want folks' eyes again to glaze over. Okay, let me start with my layman's term because you start throwing a whole lot of medical terms. I don't know all that. Listen, I don't know what you was talking about. You start mentioning this and that. I'm like, oh, I smoke cigars. I smoke cigars. I'm not medical. So, based on the fact that this is an IV,
Mhm.
so there is some medical skills, obviously, because you're a nurse.
That's right, I'm a registered nurse.
Okay, there we go. Because folks might be listening, like, "Whoa, I'm about to go there and get it like a real IV, like,
Yeah, yes,
yo,
I
I'm
am
at the
a
hospital
registered nurse.
IV." Yeah. So okay, so you're a nurse and you're the
Yes.
one who administers the IVs.
Yes, I'm the only one right now who's administering the IVs. And if I do bring somebody else in who may assist me at times, she's also a registered nurse who is one of my good friends.
Okay, folks, you got it. So now you can relax, people, because people are like, "Whoa, I'm going where to do what?" So these are medical professionals who are doing this. This is not Bay Bay and Mook Mook and Nana from the lounge. These are medical
Absolutely not.
professionals that are taking care of you folks. So, okay, we can relax a little bit. Okay, so now we're going to go back into some of those. You start using a whole bunch of medical terms. I'm going to use some layman terms. Okay, so
Okay,
if,
I'm sorry. I have a tendency to do that.
well, that's not a
Go ahead.
problem.
I'll convert it for you when you ask.
Okay, so
Okay.
now, okay, so my whole thing, because most people are not going to come up there and start talking about my cells is, degenerate. They're not going to say that. They're going to say, hey, they're going to be like me. You know what? I've been feeling tired lately. Don't feel like I'm getting enough sleep. What would you recommend that I get based on, I guess, the scenario or the issues that they're experiencing? I guess that would be more so how the layman customer will come in to discuss what they need. I don't, well, so I'm not going to say folks aren't coming in spelling and spitting out some of those medical terms because, again, I'm just a public school guy. So excuse me. I'm going to come in, I'm going to come in there and tell you, look, I'm tired or I've been drinking all night. Don't tell nobody. I need to get back to work. I need this and that. So is that normally how it will work?
Yes, it is. That's exactly how it will work.
Okay, so
And we have something specifically. If you come in with a hangover, we have one called About Last Night.
oh, about last night.
About last night, okay?
So let me ask this question about last night. Just to jump on one scenario here. Okay, so now you've been drinking all night.
Hmm.
What would be the best time to come and get about last night? You wake up that morning. I don't know the hours. Just we're gonna get into the hours of operation, but okay. Should that be like something I do first thing in the morning? Like, look, I need to make a phone call tonight to send them a text or
Yep.
send them a message. I need to be in there
Yep.
first thing tomorrow morning to get my day going. I need this about last night. Is that the best way to do it?
That's absolutely the best way to do it. Call in, let us know because our hours are actually from 12 to 8. However, if people make an appointment, I'm willing to accommodate those schedules. Like if you say, hey, I need about last night and I need that about 8 o'clock in the morning, I will come in on appointments only for things like that.
Okay, so now I come in, get set up. Is there anything I need to do to prep myself, and how long would this take for me to receive this treatment?
Usually, what I do say is just make sure you have a little something on your stomach because with vitamins can cause you to become a little nauseated. If you don't come in with anything on your stomach, we do have snacks, small snacks to provide. Um, and usually the infusion can take anywhere from 30 minutes to 60 minutes is the longest.
Okay, now after this treatment, how fast does this, how fast will I feel like, okay, this is working? And what's the normal
You should
process? Maybe within 20, 30 minutes, hour. How is that working?
What I say is you should start feeling better mid treatment. So let's say if I infuse you over an hour, by 30 minutes you should start to feel better.
Nice. Okay.
Yeah, you should start to feel a difference in yourself and start to feel like you're coming around.
Gotcha. Okay, so now again, you mentioned some other stuff earlier on in reference to, I guess, different elements that are going on. So that's one thing. Okay, that's about last night. So let's say I'm working out. I've been drinking milk. I'm doing my push-ups. I'm in the gym now. I'm feeling good. I need to get the women. The summertime's coming. I need that in
Uh-huh.
me. What do I need to do? What particular setup or what names? Because I guess you got names for these things, obviously. So if
Yes,
you
I
drink too much,
do.
it was about last night. So if I'm ready to get my muscles on and get buffed up, you know, push the ladies off of me, what I need to get? What name is that?
I will call that the exceptional drip. This
Oh,
drip has
okay.
a little bit of everything in it. It's power packed with zinc, vitamin C, glutathione, mag. I mean B12, B5, B complex. It has a little bit of everything in it. Actually, if you when I look at it, probably has about maybe 11 vitamins in there.
Nice. Nice.
Yeah,
Okay,
so
it has a
it's a
weird
little
name.
bit of everything
Exceptional
in there.
drip. That sounds kind of weird. I'm just saying,
Yeah.
that could be that could be missing. I got the exceptional drip. But what's wrong with you, my
Hey,
man? Whoa,
listen,
whoa,
this
whoa.
is why
That's
I
personal,
named them
brother. That's
like this.
personal. Don't be coming in here with that. You better go see the doctors about that. The exceptional drip. I don't know what you was doing, but that sounds like that might hurt a little bit. The exceptional drip. Okay, so now let's run down again for the folks. So if you're dealing with sleep issues, you got something for that. So give us the breakdown on what are the benefits of, okay, you got about last night, we're dealing with, okay, you drank too much or maybe you smoked too much, whatever the case was, you need that. We got a
Mhm.
workout. What are some of the other things that you offer and it benefits the folks? So we got two things covered now. What are some of the other things? I think I saw some things dealing with. There was like a booster shots or something like that. Vitamin booster shots. You can
Yes,
get
we do. We
boosters.
have booster shots. Um, we have we have vitamin D, which is good. A lot of women, and especially African American women, we are low in D3. So it's important that we should have our D vitamins. And a lot of times we don't even know until we may go to the hospital and may have the illness and they just run some labs on us. And that D is in, and they like, hey, this is probably why you're feeling the way that you're feeling because your D levels are low. So we do have that in here, which is good. Um, we have one called Lipomic. Lipomic is a combination of all the B vitamins together. And a lot of people use that for weight loss because it gives you energy, but it also helps to curb your appetite as well. So I as well. What else do we have? Let me see. We have biotin, which is skin as well. That's another shot that we have available. Once again, we have the glutathione shot as well, which is good with detoxifying the liver, helps to boost your immunity as well. It's
No,
when I say it's good, it's good.
let me ask you another question. Okay,
Now,
is there a
I'm just trying
regiment
to
that's
think of
one could get on?
everything because there's so much that we have. Um, we have the D3, glutathione, lipomic. I went over. Even if you want instead of having like all the B vitamins together, you can have like the B12 by itself, which is good. Also, that's an energy, gives you that energy and helps, the more energy we have to remember the more fat we will burn.
Okay,
You know,
so
so
now
that's something good.
let me
Once
ask this
again, I think the
question then.
ladies will love that, but also the men too, because as men, you guys need energy too.
So that's what I'm saying.
Um,
So
yes,
if I'm working
but
out,
we have a drip. Let me go back to the drips. We also have a drip that focuses on weight loss too. Um, for anybody that would be interested in that as well. We have another drip called the Her Drip, and it's for women that may suffer from PMS symptoms. Having a cramps, bloating, just feeling miserable at that time of the month. We have a drip that focuses on that because one thing we have to remember as women is our vitamin B's helps with our PMS symptoms. So that's something good for, I think, all the ladies out there to know too as well.
okay. Now if I'm on a regimen, I'm working out, I'm starting to do my thing. How often would I need to maybe come and get this treatment?
What I always recommend is monthly.
Monthly, so basically every
Mm-hmm.
30 days or so.
Yep. But if you are like somebody, let's say for the men, if you are participating in like a marathon or you working out strenuously, because remember, every time we work out, we are burning a lot of stuff off of us with the sweat. When we sweat, we're losing our vitamins. So what I will say is that if you are if you do more like that on a regular basis, what I will suggest is maybe every 2 weeks instead.
Okay, so if you're going hard in the gym and you're doing your marathons, you're
Exactly.
doing running, you're running 13, 14 miles a week, you would need a little
Mm-hmm.
bit more often than just a regular Joe or Jill.
Yes.
Gotcha. Now I got to ask this question: are there any side effects to this? There anything that may, everything seems like has some type of side
Exactly.
effects. Are there any particular things that folks may need to look out for? Say, okay, that's normal. You had a treatment. This is
The
going
main
on. That's normal, so it's okay.
certain things what I will say is that we have a medical director, Dr. Amber Manning. She's our medical director. Awesome lady. Um, if you do have any like underlying medical conditions, before I start your infusion, what I will do is call her and you will consult with her first to see if you are eligible to receive the infusion. So let's say if you are a person with kidney disease, some type of kidney disease, before we would infuse you, we would call her and she would give the yay or nay at that time to let us know that it can be done or it can't be done. The side effect that I've heard of somebody having in the past is what was it? I'm sorry, hives, and it was because they were allergic to a component of the B12. If
Mm.
you do have anything like that, we have everywhere equipped with everything in here. We have steroids to give you. We have Benadryl, everything like that. So just in case you have any side effects, these are the things that we are equipped to give. But it's rare. Like I've barely ever heard of anybody even having a side effect. It's just something I had to throw out there because somebody told me about it.
Gotcha. Okay, sounds good. So now your hours of operation are again what? Let's give out the address again so folks know where they can go, and we're gonna give the address out, the hours of operation, and the way to contact you, whether it be a phone number, a website, or a combination thereof.
Okay, our hours of operation is 12 p.m. to 8 p.m. I'm sorry, Tuesday to Friday. And on Saturdays, we're open from 12 to 5. Sundays, we're closed, and Mondays, we're only by appointments.
Okay, so Mondays are only appointments. Okay, gotcha.
Yep, Mondays is appointments only. And our address is 4433 Summit Bridge Road, Middletown, Delaware, 19709. Our website is www.hydroboostivtherapy.com. Our phone number is 302 376 8347.
All right. Well, there you have it, folks. There you have it. Like I said, if you're feeling tired, she just broke it down. You're working out. You want to get pretty Ricky. You need those vitamins in you. You need to go see him. Hydro Boost. Go see
Yes, and
Reed. You got to go see
also
him.
let me let you guys know is that we do parties too as well. So if you want to have like a bachelorette party or a bachelor party, we do parties and even for girls' night or for even the men's night out.
Oh, parties. Okay. Well, wait a minute. Okay.
Yeah,
I got to
yeah,
stop right.
our first
Okay.
party
So
scheduled June 3rd.
a party. Okay. So they're IV. Okay. So how does this work? So multiple people can get hooked up or just one at a time? Or we all can get.
multiple people. We have enough seats to sit 12 people.
Whoa. So now you're having parties. You can party with the
Yes.
IVs.
Yes.
Oh, man, this is some new stuff, folks. Are y'all listening to this? We partying with
yeah.
IVs in this now. Whoa. This is some new stuff right now. A party. So you can have a bachelor party, birthday party, whatever kind of
Yes.
party you want. Get plugged up.
Whatever
And
kind.
So let me ask this question. With the parties, what do you normally give the party goers? Is this a booster? What shots?
No, we
Which
got
plug? Which
any
drip
bag-
is this?
Any bags they want.
Oh,
They'll
any
look at our
bag they want.
menu. What we'll do is we'll, talk to them maybe like a week in advance. We'll talk to them, and the night before, what we'll do, we'll make all the bags. So by the time they come in, everything will be ready. And all we have to do is just hook them up to the IVs, get the IVs started, and get them running. And they can sit around, talk, laugh, sing, just have a good old time.
Okay, so you can request. It's like a buffet here. So you go
Yeah,
there.
it's like a
Let me
request.
see. I want. Give me that one. Give me this
Yeah.
one. Oh,
We'll
nice.
have a TV sitting there. I'll pull out the mics for you guys to sing while you relax back in the chairs.
Are these chairs? Are these like the? If you ever give blood, you got those. I think you got to lay down. Are you laying down? What position are you in? Or are you sitting in a nice, comfortable chair with your feet up?
Yeah, you're sitting in a lounge chair.
Oh, yeah, we know about the lounge chair smokers.
Yeah.
We know about nice, comfortable lounge chairs. We know the good ones. We know the bad ones. We know about lounge chairs. Okay, so let me ask a question here because I'm not going to give everything away. I want folks to go to the website and check you out. So the pricing and everything will be on the website. They can get all kind of pricing on the website, I'm assuming.
That's correct.
Okay, so folks, there you have it. You need to go to the website to get the pricing. Go check it out. Hydroboost. Do me a favor. Give that website out again one more time.
Website is www.hydroboostivtherapy.com.
All right. Well, like I said, as we wrap it up here, is there anything else you need the folks to know that maybe I didn't cover, that I didn't ask? What do you want to let the folks know here before we wrap up?
One other thing is that we do have private rooms, so just in case you may want to come in and you want some privacy and you want some quiet time or you want to just do some work on your computer, we do have 3 private rooms, okay? And then also, I just want to let you guys know is that we're bringing Skin to our facility too, and it's a weight loss. It helps to decrease you in inches. Like we can apply it to your stomach, we can apply it to your legs. It helps to decrease your cellulite. It helps with skin repair. If you have like a double chin, some of us have the giblets after time.
Whoa, watch yourself! Don't be hurting everybody's feelings now. I'm sorry, hurting feelings now with the
You
chins.
said I can say whatever I want to say. I got a giblet too. Okay.
I'm sorry. Continue.
I have a giblet too. Okay. So.
Hey! Tell people to mind their business. Mind your business.
Exactly. Okay, my giblet is my business. Okay, but we will be offering Skin too, so that should be coming in about, I'm gonna say, the next month. That should be here as well.
Nice. Well, there you have it, folks. Got Ree from Hydroboost up in Middletown, Delaware. Check her out. Go check out the website. Listen, Ree, appreciate you being a guest because this was an education for me. I'm pretty sure it was an education for my audience because, again, this is not something that I see every day. So I appreciate you being a guest, explaining everything to us. Thank you.
Thank you for having me.
Definitely. Well, there you have it, folks. Another episode of Smoke World in the books. Again, you can follow me on Instagram at Smoke World Podcast. Email stone@smokeworldpodcast.com. Website, folks, check it out, smokeworldpodcast.com. Appreciate you listening. Don't forget to like, share, and subscribe. We will check you out on the other side. Peace.